So we start with a cleansing action just to clean the skin. Here I'm using the cleansing oil from the Skin Perfusion range. It's also an ideal opportunity to assess the skin and have a look at just the open pores, the laxity, and how well the skin is likely to react to the treatment. So I'm just cleaning the skin with these disposable intrinsic cloths there that will just help to remove any dead skin cells initially or any grime. Now I'm going to be applying the main part of the preparation phase. Here I'm using a perfecting solution that Skin Perfusion have. You can also use a light peel, which I commonly do once I get more familiar with the skin. So the idea is to put the peel on the neck, the décolletage neck, and onto the face. The idea is to leave this on for at least 3 minutes, and then I will remove with, again, just some dampened cotton pads. They may feel a slight tingling sensation whilst the peel is dropping the pH of the skin down to either 3.5 or thicker skin down to a pH of 1.2. Now I'm putting a light layer of the NCTF 135 Hyaluronic, or the cocktail serum, onto the skin. Now, starting with the needling, I have the depth of that needle at on the chin there will be at 0.5, and then as you move along the jawline, I'd sometimes move it a little bit deeper at about 0.75 or 0.8. I'm using a cross-hatch technique. I'm not going backwards and forwards, and I'm not doing circles. I am doing lines. And now I've dropped this needle down to about 0.5 at this particular point. As we come up over the cheekbones, it can be quite sensitive, particularly on the edges here. I'm putting a little extra bit of serum on there just to kind of help with the glide as we're going over the cheekbones. Perfect around the top layer here, just to sort of remove those open pores and help improve the skin cell turnover around there. Can get quite oily sometimes. And then with the fantastic part of micro skin needling is that you can get right into the deep close to the eye area. So we focus around the thick side of the eye there, that will be at 0.25, but closer inside the eye area will be a depth of 0.1, where it's really delicate. As we move over the brow and into the forehead, you'll notice that you'll know that your skin is a little bit thicker. So the idea here is that I'll probably increase it to about 0.25 and work into those wrinkles there into the brow. Still targeting the skin tightening and the skin rejuvenation. This will make you sneeze, just as we hit the nerve on our forehead. Quite often the clients will sneeze. And then we repeat the process on the other side. So again, quite deep on the cheek and the jawline area at 0.75, working on a cross-hatch situation. And then I do a wash, as I like to call it. I drop the needle down to 0.1, put another layer of serum on, and do another quick wash, as you can see. Fantastic for just the sort of real surface issues. Claire's got sun damaged skin, so fantastic for pigmentation. So now applying the collagen ghost mask, this is a delightful moment. Claire's skin now is starting to get warm and hot and react to the needling. This cold, wet, damp face mask is a delightful reprieve, really. It's a nice feeling as it goes onto the skin. And then I just remove that sort of thicker part of the mask. Focus down on the neck and décolletage, again applying a little bit of serum, and then we tend to work at 0.8 to 1 mil on the neck area. Can go down to 0.5 if it's quite thin skin, and look at those big long strokes there work in the area in a nice cross hatch, makes me get under the chin. It can feel scratchy, but as I say, I'm quite quick at that, so we just get that done. The décolletage is quite thick skin, and therefore you can work at 1 or 0.8 mil on the décolletage area. Reapplying the serum just helps with the glide, but also obviously layering the serum in is good for the neck. And then there's often a little bit left in the packet of the mask, which I'll then reapply back over the neck and décolletage area there. Nice bit of collagen, lovely and soothing. So then I apply the Jade roller just over the skin, helping with a little bit of lymphatic drainage. We'll sit there for say 20 minutes doing this. It's just really a soothing element that I do this for, not really for any particular routine. It's just to help push the product into the skin and help Claire feel a little bit more comfortable during the process, because her skin is getting quite warm at the moment. But as you can see, she's very happy. I'm dressing her up now like a mummy. They're cold wet cloths. They're just lovely on the neck again, just to go over with the Jade roller and just add a soothing effect to the skin. So then we remove ever so gently, not rubbing because it is sore, just dabbing. She's got all the product out of that mask, and then we just destroy that, throw that away. Nice gentle wipe, again, nothing too aggressive. Her skin's quite tender, but as you can see, no blood. Absolutely no blood, not even a pinpoint bleed. I like to apply a little bit of eye cream in the area and just do a little bit of a massage around there to help with the lymphatic drainage. I think it's the facialist in me, I can't help but be nice. So there's a little bit of a neck massage there and a little bit of natural lifting. So now it's time to preserve the work that we've done within the skin, and I apply a B3 recovery cream by Skin Perfusion. It's very calming, just sits very gentle on the skin. It's not overly reactive, but it's got the B3, so it really does work very nicely on the skin without overreaction. And then also apply the SPF 50 straight away as well. The channels in the skin will have closed up now. That closes up during the time that you have the mask on. So the skin has now absorbed all the serum and is very happy to have cream laid on the top. There's my lovely Claire. That is how you should look after a micro skin needling. Post microneedling skin treatment aftercare advice is to avoid makeup for at least another 20 minutes if you can. You can reapply if you are going out on a lunch date or you need to go back to work. It's not a problem, but my advice is to try and avoid wearing makeup for the rest of the day. Avoid any excessive sweating, so things like going to the gym or going for a run or going for a sauna, anything that will re-stimulate your skin. It will not damage your treatment or damage your skin in any way or even affect the treatment. It just hurts and it's not very nice. Also avoid any exfoliation, so no further liquid acids that day or for a further sort of 2 days. So avoid any acids on your skin, even any product-based scrubs or exfoliations or any masks that contain, say, a glycolic or a lactic. So you don't want to put any further exfoliation products on your skin for at least 24 to maybe even 36 hours. Avoid all other treatments, whether evasive or non-evasive treatments. So no hair removal, no tattooing, and again, I wouldn't have any microdermabrasion or anything like that on your skin. Just let the next 2 weeks pass you by. The main reason for me and why I give that advice is that if your skin reacts to anything, I know what I've done and I know what advice to give you. If you've had another treatment on top of that, I'm lost. I don't know where the root of the issue is. They are the main reasons and the main aftercare that I'd like you to do post-treatment, or I recommend post-treatment. So things to do post-micro skin needling treatment is to apply an SPF 50+. The other thing is to not panic. It may feel quite uncomfortable, a little bit sore and a little bit red. Just apply a simple cleansing milk. Nothing too complicated, nothing too active. You just want to calm it all down. But do continue life as normal. You can go to work, you can go shopping, you can go for a walk. I'm going to say you can go out in the sun because you've got your SPF. The main reason I say that is that the epidermal layer of your skin has not been broken. It's the needles have gone in and out very quickly and then the channels are closed. So as long as you have your SPF on, there's no further damage or exposure or massive concern for being outdoors. Just add simple serums and creams. Seriously, for the next 2 or 3 days, there is no point adding your fancy serums and your expensive creams to your skin. Whilst I have no blood on my treatments, there is trauma, and I have already put in with the serum the product that your skin wants. It has everything it needs. It's got something like 59 different ingredients. It doesn't need anything else to confuse the situation. It has everything it needs for each cell at the top to communicate down to the next cell and give that next cell the information that it needs to be stronger and firmer, because next door to it, it has all the nutrients and the growth factors and the peptides that it needs. So as it comes to the surface and then it passes the message down to the next skin cell layer, everybody's happy. If you start adding in another layer of serum and another layer of active ingredients, these skin cells are going to get very confused and lost. They're traumatized. You've given them the comfort blanket. Let them just sit with it and let them deal with it. Yes, you can go back to your normal skin routine, maybe post 5 days or 7 days, but let your skin just sit for a bit. Let it deal with what you've done to it. How will your skin feel post microneedling treatment? Well, the overall summary is wonderful, but you will feel a bit pink and a bit glowy is the best way to explain. Between days 3 and 10, what will happen is as I've pushed product down to the next layer, the top layer of skin will start to just sort of flake away. So you might feel a bit itchy and a bit scratchy. Again, do not panic, do not do a peel, just leave it. Let it do what it wants to do. The hyaluronic acid that I've pushed down into the next layer of skin is pinching all the water from the top layer. So the top layer is just being discarded and the bottom layer of skin that's coming through is collecting all the nutrients. It's a good thing that you feel a bit itchy and a bit scratchy. From day 11 to day 14, we're cooking on gas, should I say. Your skin should get rid of all that shedding and come through feeling lovely and soft. Then from 14 to 28 days, and then potentially even further on to that into the second month, you'll start to feel a firmness to it and you'll be very contented with the treatment. That is the overall cycle, and the trick is you do it all over again.